Physical activity in type 1 diabetes. Key points. Most people find physical activity improves their feelings of wellness and vitality. It also helps in managing stress. Physical activity makes your body's cells more sensitive to the action of insulin. Your body remains more sensitive to insulin for up to 24 hours after physical activity. You may need to reduce your post-physical activity insulin and/or eat more carbohydrates following physical activity. The key to managing physical activity safely with type 1 diabetes is to monitor your blood glucose frequently and use this information to adjust your food and physical activity accordingly. Avoid injecting pre-physical activity insulin into any area of working muscle. It may get absorbed much more quickly than usual if you do. There are risks to physical activity. You should have a thorough medical check and consult with your diabetes specialist team before starting a physical activity routine. Keeping up a physical activity schedule if you have type 1 diabetes is an exciting challenge for your diabetes management skills. It helps if you start with a clear understanding of the interactions between insulin and physical activity. To begin with, it is useful to understand how a person without diabetes uses glucose during physical activity. How the body manages its glucose levels during physical activity in people without diabetes. During physical activity, the muscles work harder and need more glucose to burn as energy. They pull glucose out of the bloodstream, blood glucose, as well as using up glucose that has been stored in the muscles, glycogen. Insulin works on the wall of the cell to allow glucose to get in. During physical activity, the muscle cells become more sensitive to the action of insulin. This means that the body doesn't need as much insulin to achieve the same job, moving either stored glucose or blood glucose into the muscle cells where it can get burned up. Because of this, the body starts to gradually reduce its production of insulin. After about 30 minutes of moderate physical activity, the supply of glucose from the blood and from the stored glucose in muscles, glycogen, starts to run out. Blood glucose levels start to slightly drop. These slightly lowered blood glucose levels cause the body to change its hormone levels again. The hormone levels that it changes are insulin, glucagon and adrenaline. The body decreases the amount of insulin even further and increases the amount of glucagon and adrenaline. The change in these hormone levels then causes the body to do two things. To switch to using stored glucose from the liver. To stimulate the liver to start making new glucose from stores of protein and fat. The end result is that although existing blood glucose and stored glucose glycogen in the muscles are used up, the body maintains a constant blood glucose level. This is because the body has changed its hormone levels and by doing this has turned the liver into a glucose factory. The liver releases its stored, or newly made glucose, into the bloodstream. People who are able to make these hormone level changes automatically can conduct physical activity over prolonged periods, e.g., running a marathon, without any dramatic change in their blood glucose levels.